Okay. Yeah.
Thank you, Dr. Abhishek. Thank you, Hindi team. Now we are moving to English session.
Thank you.
Welcome everyone for today's session. Before beginning the session, we will have a silent prayer. Good evening and welcome everyone for today's English session. Today is our 2170 second day of continuous webinar. Thank you all the participants for joining with us and welcoming all of you once again. And today's our speaker is Dr. SANKET GUPTA. He is MD in Homeopathy and working as a consultant in AKG SOV IHAMS College, Homeopathic Medical College. And today's our subject is managing respiratory cases with homeopathy. I am welcoming you, Dr. SANKET GUPTA, for today's session. You are welcome. Please.
Good evening, everyone, and thank you for inviting me. It's been a pleasure and a privilege to always come back to IFPH and share not just share knowledge, but gain also. There's a lot to learn from the efforts you all are putting in. And thank you to Dr. Sani and Namaskar, Dr. Shah. So today I'll be talking about how can we manage acute respiratory diseases, especially those diseases which are considered to be, taken care of by allopathic hospitals, and mostly they are referred to the hospitals in case of emergency. There are some beautiful medicines, beautiful ways where we can prescribe homeopathic medicines, and beautiful cases I would like to share in certain pathological diseases where in acute respiratory conditions, homeopathy can do absolute wonders. So I'll just quickly share my screen. Also, very happy advanced, Independence Day to all of you. So I've titled my presentation as Brilliance of Homeopathy in Acute Respiratory Diseases and How We Can Manage That. The kind of air we are breathing in, especially in the metros like Delhi, Kolkata, Mumbai, even Mangalore and Chennai, and a lot of other tier 2 cities as well, is not really helpful, is not really breathable to say the least, especially in Delhi. And the cases of respiratory diseases that we get in our clinics is increasing day by day. We are every day getting new kinds of fevers, new kinds of resistance to antibiotics, new kind of pathologies, and new kind of modalities even. And as a homeopathic doctor, we also have to keep ourselves up with those challenges. And some wonderful medicines are there that I would like to share today that help us in our clinical cases, in our clinical practice. We all talk about the dictum of constitutional disease, constitutional prescribing, and constitutional medicine. That is fine. That is, of course, the path to cure. But once a patient arrives at our clinic, especially in case of such emergency situations and critical situations, he or she needs relief, immediate relief. And mostly an organopathic medicine, depending upon the PQRS. Of course, PQRS has to be in the background. Not taking the entire case fully, it is not possible at those times to take the entire case fully in the acute prescription, in the acute case taking, especially in the clinic setup. When you are seeing such patients day in and day out, and a lot of patients, then you tend to decipher and differentiate between certain medicines and give the precise medicine, and it always shows up with fantastic results. This is the brilliance of homeopathy that I would like to share today. I'd like to talk about a few particular diseases and will share a few here and there as well. Firstly, would be about acute tonsillitis, then about pneumonia, then acute respiratory distress, and then acute bronchitis. As I said, my approach is clinical. it is a therapeutic prescription, usually an organopathic prescription with PQRS in the background. That is the most important thing. Even if it is a organopathic prescription, it will always have something peculiar about it, which is the characteristic of that patient in that state, in that condition. And that is what gives him or her that instant relief, going absolutely by the principles of homeopathy. So we all see a lot of tonsillitis cases in our clinics. I don't need to narrate what it is, but some of the most fantastic medicines that I've used in my clinic, and I'm sure most of us agree with this, is like Merxol. Merxol, it presents with intense thirst and with extreme difficulty in deglutition, complete, difficulty and inability to swallow, and especially the complaints aggravate at night. The fever goes extremely high, child has immense pain, but with that, he has that desire to have water, that immense thirst to drink water, even though the swallowing is completely difficult. Merxol never fails in such cases. Along with Merxol, I would like to add there's a medicine called staphylococcin. This never fails whenever there is a case of follicular tonsillitis. So I always start my prescription in a case of follicular tonsillitis with staphylococcin 1 m or 200, depending upon the severity of the case. And I would do only 1 or 2 doses. And it presents with the peculiar pus point, like a peculiar folliculitis in the bed of the tonsil of the enlarged tonsil. Even if it is bilateral, even if it is unilateral of any side, always start with staphylococcin 1, and that's what I do. And immediately with 1 dose itself, because it is a staphylococcal infection, follicular tonsillitis is usually a staphylococcal infection, it gives immediate result. Immediately the patient is relieved of the pain. You gain the trust. You gain the patient. You gain that confidence in him that homeopathy can heal him, and then you can cure him or her whenever they present with the chronic condition, because it is a chronic tonsillitis is usually a chronic condition, and patients will always come to you when they are in case of trouble. Kids have been drugged many a times with antibiotics. Parents will come and tell you ki, it's been 15 days, every 15 days or 20 days, he gets up with a pain or a change of weather, he gets up with a fever and a sore throat, and we are tired of giving him antibiotics. We've been giving him antibiotics for 3 years, but his tonsils keep on appearing and reappearing, and now they are just stuck. But remember one thing, patient will always come to us in case of an acute condition. He or she would be brought to us by the parents in that acute condition, and that is the make or break for the doctor. He or she is not concerned whether homeopathy is slow or fast or whatever it is. He needs relief. He needs that instant relief in 1 or 2 days, so that his child is able to breathe, is able to eat, is able to drink, and fever reduces. So this is where such acute remedies come in to picture. And once the acute condition has been settled, we can always take care of the chronic condition, and we can cure him or her constitutionally. So as I said, Merxol and staphylococcin, especially in follicular tonsillitis. Then lachesis is one of the very, very frequently used medicines in my clinic. Just 1 or 2 doses of lachesis, or even 3 doses of lachesis, especially in left-sided tonsillar hypertrophy, with pain radiating to the ear and making it impossible to lie down, resulting in choking. This is a classical symptom a child of lachesis would present with. Lachesis-based tonsillar hypertrophy, and it never fails. It always gives that instant relief, and the patient is all right. One very important remedy is phytolacca, which most of us also give, that when pain is aggravated by hot liquids, usually any sore throat or tonsillitis is better by hot liquids. But the peculiarity of phytolacca is it is aggravated. Is condition becomes worse by taking anything hot. So phytolacca, be it bilateral, be it unilateral, if you are getting this modality of aggravation from hot liquids, phytolacca never fails. Then another nosode I would like to introduce, not introduce, but reintroduce to many of you is streptococcinum. Streptococcinum is a very useful remedy. It's like the tonsils are so engorged and congested. It's red, intense red, especially when belladonna fails in initial conditions, in initial inflammatory stage of a tonsil. If if that is not giving you an action, streptococcinum never fails. You can always start with a streptococcal dose of streptococcinum because it is a streptococcal infection. When it is red and inflamed without any folliculitis, then it is usually a streptococcal infection. Simple child had something cold and developed a engorged throat and red, literally blood red, congested throat, then please try streptococcinum. Start with it. Just give 1 or 2 doses or maximum 3 doses, broken into 3 doses half hourly. It always provides that instant relief to that child. And even the fever is, taken care of. A high grade fever with staphylococcin and streptococcinum is immediately taken care of. With lachesis is immediately taken care of. No need for the child to be given any crocin or any dolo or any antibiotic. Our medicines are potent enough if indicated. Now, second and very important condition is pneumonia. Pneumonia at any age of life, at any stage of life, is a critical condition. It can happen to a 2-year-old boy or a girl, 2-year-old child. It can happen to a 70-year-old, 80-year-old adult. And usually in such immunocompromised conditions and ages, this can even be fatal. And an acute bronchopneumonia is usually an emergency and patients land up into hospital. But with grace of God and the magical tool of homeopathy that we've all been provided and blessed with by Dr. Hahnemann, I am really happy to say that we can definitely prevent this hospitalization. Even if the patient is getting a fever of about 104, 105, the blood is showing TLC counts above 20,000, CRP is out of the window. I'll share a case. Even then, we can completely cure such cases. Completely, not cure, I would say, but completely restore and prevent those hospitalization. Cure, as I said, is always a secondary process. But initially, we need to make the person viable enough, the lungs compliant enough for the breathable, for the breathing to be out of distress. So as I said, bronchopneumonia can be an emergency situation which may require interventional and invasive treatments, as many times even the strongest of antibiotics fail to act. See, usually it always begins with a fever, with a chill. A child starts with a simple cold and mild lower respiratory cough and high grade fevers, especially with chills. And most often than not, the indicated antibiotics that these guys gave, the allopaths, they usually fail, especially in viral pneumonitis. What we experienced during COVID, COVID was nothing but viral pneumonitis, viral acute respiratory distress. So all those antibiotics were failing, but homeopathy was always acting. It was always giving these results. Why? Because we are not acting on the microbe. We do not need to know the microbe that is infecting. We need to know the modality of that person. We need to know the characteristic of the fever. We need to know how the child or boy is feeling inside. How is he thirsty or he's not thirsty, or the sweat is or not. You know, our diagnosis is definitely not dependent on the organism involved. Yes, it is always better to know. It gives a better prognosis for us to understand. Obviously, our options open up if we are aware of the organism. Our nosodes come into play. But even then, even if we are not aware, even if it is a viral pneumonitis, there are markers in the if the lymphocyte count is low, it is usually a viral pneumonitis. But if the lymphocyte count is not that low, just the neutrophils are high, it is usually a bacterial pneumonia. So a bacterial pneumonia will have a better prognosis with antibiotics, but a viral pneumonia will not have, viral pneumonitis will not have a great prognosis and great result with antibiotics. And this is where, you can educate your patients and your people around that please do not immediately start with antibiotics in case of any cold and fever. Always try to give homeopathy as a primary, mode of treatment. And these guys, even with antibiotics, they fail, then they get admitted, and it takes about 3 weeks to 4 weeks to recover. 3 weeks to 4 weeks to recover. And with homeopathy, we can get this recovery done in much, much lesser time, a complete recovery. So, this is extremely important. Pneumonia is usually considered that an allopath should handle it. But no, homeopathy is very well equipped, very well, we have great tools, we have great understanding of the medicines and the understanding of the disease and the patient, and we can definitely handle this situation even without hospitalization. As I always say, with homeopathy, rapid, gentle, and permanent recovery is well and truly possible to attain, as Dr. Hahnemann said more than 200 years ago. So this is the case I would like to share. This is a case of last year. Incidentally, this boy, the video I'll be showing you, this video was shot exactly 1 year ago today, 12th of August. So quite a sweet coincidence that I'm presenting his case again after exactly 1 year. Got a chance to discuss about respiratory diseases. So this was a 2 years old boy. He's 3 years old now and had been referred to the hospital. He was having persistently high fever ranging up to above 104 degrees for 5 days. You can see the TLC count was over 17,000. In fact, it's not written correctly here. To one point, it had reached over 24,000 when they came to me. CRP, you can see, was above 250. Hemoglobin was 6.8. Urine infection also developed, and pus cells were about 20 to 25. There was rapid and shallow breathing with chills and frequent thirst. He also developed left inguinal hernia. So, this boy had been referred to the hospital. The physician who was treating him for almost 5-6 days said that the boy is not responding to the antibiotics. He should be referred to the hospital immediately. But the boy is a son of a driver to one of my old patients. So those patients said, "No, you go to Sanket once because I think he can do something." And they believed, and because maybe they could not afford also the hospitalization. Luckily, they came directly to me, and thankfully, he was completely cured. So the medicines given was arsenic album. You can see the arsenic album it was very easy for me to prescribe here because the only thing the child was asking was for water, and he would drink very small sips at very short intervals of time. I gave only arsenic album 30, but repeated doses every 2 hours. Every 2 hours. He also developed inguinal hernia. You have to understand, he's a 2-year-old boy, and due to intense coughing, the inguinal canal got ruptured and he developed the hernia. So it was a right-sided inguinal hernia, and I gave him rhododendron for that, just a single dose. That was given in between, not on the first prescription. Also, he was given Kali chloricum. Kali chloricum is a wonderful remedy for urinary tract infection. You can see here he has urinary tract infection also there. So the UTI here could be due to multiple reasons. As I said, he was not from a very well-off background. It could be due to unhygienic environmental conditions. It could also be a result of, the fever. The fever when, the infection, not the fever, the infection. A high infection, a high bacterial condition and infection can always lead to viral infection can always lead to UTI also if the child is, it is a sign of dehydration also that once you are not consuming enough liquids and enough nutrition, the bacterial colonization starts happening, and then also you can start developing urinary infection, which is very common in such infections. You can get it from hospital also. So Kali chloricum was given as a specific for that, and it always acts. It was given TDS 3 times a day. He was much better by now. So he came to me on 28th July, and exactly in 1 week, he was completely better. There was no fever, very much back to his normal. No fever, no coughing, no breathlessness. Inguinal hernia was restored, remember, in just less than 1 week. No pus cells in urine, less than 1 week. CRP 8 from 250 to 8. TLC count absolutely normal from 17,000 ranging up to 24,000, much in normal limits, up to 7,600. But his hemoglobin was 5.3. It had come down to 5.3. The child, if you see, I'll show the video. He had become really frail due to all this infection and all. He was not really eating well. It was just in the last 1 or 2 days that he had starting eating a little. Hemoglobin at this level, at this low range, I advise them to get just a simple blood transfusion done at their nearest medical center, because it is, even if this is not allopathy or homeopathy, yes, we can restore hemoglobin. Yes, we can restore it with many medicines. But we have to understand the gravity of the situation here, the severity of the situation here. The child who was under so much of trauma due to an infection, under so much of distress, respiratory distress, viral distress, nutritional distress, urinary distress, inguinal hernia distress, not eating at all. Obviously, hemoglobin was not going to improve any soon. And the parents were really concerned. So I just advise, just get a blood transfusion done for a day and he should be fine. And yes, there is no harm in, adding any allied methods, or, we use physiotherapy, we use uh, occupational therapy in cases of autism. We use physiotherapy in cases of arthritis and bone disorders. So there's no harm in adding allied, allied stream where it is a need of the hour. It was an emergency case and it needed such action. So this is the final result. This is the video exactly 1 year ago. You can see the mother is talking about her case.
फीवर बहुत था, इसकी सीआरपी बहुत बढ़ी हुई थी, तो इसे 1 हफ्ते में रिकवर हो गया बहुत अच्छी तरह से, और इसके जो पेशाब में भी गांठ हो गई थी वो भी बहुत जल्दी थी.
You can see the happiness on the face of the mother. She was very shy on coming on to the camera, but she said, all right, I'll just give a small testimonial. And this is what I was trying to add, that such cases only give us that confidence that even a respiratory condition, a respiratory distress and an emergency like bronchopneumonia and like pneumonitis, like viral pneumonitis, can be completely restored to health, complete health with homeopathy alone without any hospitalization. The only thing that was required from an hospital setup was just blood transfusion. That was after the complete recovery. So I hope you will appreciate how well homeopathy can do such cases. Now, I did a small comparative study of where, I usually tell this to all my patients who come with such conditions, why there is a difference, what is the difference, and why they should choose homeopathy over conventional approach. I think we all homeopathic doctors should, who have a lot of respiratory cases in their clinics, should use this slide as a tool to teach and educate the patient and families. So the conventional approach or the allopathic approach is usually heavy immunosuppressive antibiotics. See, we are dealing with a completely battered case, an immunity compromised case. And if we keep on giving such medicines which, hamper the immunity any further, it is not going to really help. On the other hand, the homeopathic approach is small, gentle immunity boosting medicines. These are simple words that the patients will always understand. You can always help, tell this to your patients and educate them. As I said earlier, the conventional approach is dependent on the microbes, the drugs which are resistant mostly. See, microbe dependent drugs which are resistant mostly. As we are seeing these days, a lot of antibiotics are becoming resistant to the infection. I mean, the microbes are becoming resistant to the antibiotics. The multi-drug resistant tuberculosis, the superbug are such examples. I mean, hardly out of a plethora of 20 antibiotics, one would be sensitive. Mostly would be resistant, and the sensitive one wouldn't really act as much as is expected, and hence the patient is put on to the IV antibiotics and whatnot into the hospital. But as a homeopathy doctor, we are not dependent on the causative agent, as the focus is only on the symptoms produced by the body. As Dr. Hahnemann said, whatever the body manifests, the doctor should be able to observe. And once the doctor observes correctly and matches with the simillimum here becomes the most prominent and the indicated remedy in that condition. Not always the constitutional approach would work. Here, the approach is only PQRS. It was a no-brainer. The child wanted just few sips of water, a sip of water, and keep it on, and sip of water, keep it on. It was completely no-brainer for me. Just gave arsenic and it showed the magic. So if I was lucky enough that I could get those symptoms, but we always have to, catch that out. We have to look for it. You will always get a symptom. You will always get a symptom, especially if the patient is not that drugged. Even a gap of, I always suggest if a patient is on antibiotics and has been on antibiotics for say about 7-8 days or 6-7 days, just give a gap of about 15 to 16 hours or 24 hours. The symptoms now that will appear would give you the correct picture and give you the exact modalities and the exact picture of the patient, symptoms of the patient, and that would be always easy to prescribe on. I mean, we all are capable enough. Dr. Hahnemann has made us capable enough. Our teachers have made us capable enough. Our books have made us capable enough that we would be able to choose from the acute remedies. So patient usually ends up in hospital and takes very long to recover when he is treated through a conventional approach of allopathic medicine. On the other hand, hospitalization can be very well prevented with complete restoration to health with the homeopathic approach. The prognosis is poor with conventional approach, as many times patient does not really come back home. But with homeopathy, the prognosis is really good and we can prevent hospitalization. So that was all about bronchopneumonia. I hope you have gained something out of this. The third condition I would like to talk about is acute respiratory distress. So what is an acute respiratory distress? Distress means when you are not able to breathe. Even see, breathing is something that we should not be aware of, right? We are blessed, all of us right now, that we are able to not recognize that we are breathing, that our lungs are working, our nose are working, our oral cavity is working, our uh, respiratory canal is working, our bronchioles are working. Once you are aware of that, that means there is a problem. And once you are aware, not just aware, you are made to breathe, you are made to work, you are short of breath, that is a distress. And a distress can be really, really critical. It can be fatal again. It is usually an acute emergency again in a hospital setup, in a medical condition. And uh, patient patient presents with mild tachypnea. So tachypnea means difficult breathing. Initially, he or she would present with difficult breathing, even at rest. Acute shortness of breath, labored and usually unusually rapid breathing. So it's like panting mostly, gasping of breath. Patient would really feel as if there is no, he would, be very, very labored breathing and very rapid breathing. Due to the lack of oxygenation, there would be confusion and extreme tiredness. When there is respiratory distress, there is disharmony of the gases, of the pulmonary gases, the oxygenation and the carbon dioxide and oxygen. So that is why it is an acute emergency. It is a condition of hospitalization, and confusion and extreme tiredness happens due to this lack of oxygenation. Rails are frequently heard in auscultation. In fact, mostly you don't need to auscultate even. You can hear the literally the ribs striking against each other once the patient is breathing. Obviously, the blood pressure would be really low. You can have a look at a patient of ARDS, acute respiratory distress, and a normal patient X-ray. You can see the normal X-ray shows the lungs beautifully filled with air, normal air, no constriction. But on the right, you can see it is a condition of complete collapse. If you can see the almost a collapse of the right lung, hardly any lung capacity, any air is there. Breathability you can imagine could be very, very difficult. You can see even the heart is a little enlarged. When you need to breathe, when you are made to breathe with difficulty, there is always a back pressure, always a how to put it, more load on the heart, and usually cardiac hypertrophy happens with that, or a core pulmonary as well. Pulmonary edema also happens in such cases. So some of the homeopathic gems that have really helped me in treating respiratory distress conditions. See, I'll tell you something. What we noticed during COVID, that there was a sudden dip in oxygen of patients, is a respiratory distress, right? A respiratory distress is not one disease. Respiratory distress is a condition where patient is completely out of breath. It is a shallow and rapid breathing and with a very low blood pressure. It is completely an emergency situation. right? It can turn fatal. But there is a remedy called lorocerasis. Literally, I just love this remedy. I use this remedy a lot during COVID times, and it never failed. I am this was the first time, in fact, I used it in COVID times also. When I was called to see a patient just three doors away from my clinic, the oxygen had dropped down to 59, 60, 61, was hovering between that, and the fellow, he was an old man. He was an acute, a chronic emphysema patient also. They had been my patient earlier. You all know the condition of the oxygen cylinders was very bad during those times, especially in Delhi. So they were not able to procure any oxygen cylinder for themselves. And they just called me if something can be done. I saw him. He was literally gasping as if he just needed an oxygen mask. He would just pull, give me something. He was just doing something with those gestures with his hands. And I gave him lorocerasis 30 potency directly on his tongue. Believe you me, he was, I should say, better of he was back to normal life in less than 15 minutes. In less than 15 minutes, he was able to, he started gaining his breath in less than 15 minutes. And not just gaining his breath, by half an hour to 1 hour and later on to 2 hours, we kept on giving him lorocerasis every 10 minutes. Every 10, in fact, initially I was giving him every 5 minutes, then 10 minutes, then made it 20 minutes, then made it every 1 hour. And by the night, the oxygenation had come back to normal about 90, 92, 93. It was never 95 in any case, but he was always hovering around 90, 89, 90. And it was back to 90, 91. In fact, he had a low grade fever as well. For that, I remember I gave him a dose of pyrogen 30 later in the evening in the same day. But it was lorocerasis that got the, that 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 cough and that gasp for breath, that distress. It was the magic of lorocerasis. Fantastic remedy. And since then, I always keep it in my emergency, kit for patients, that whenever there is a respiratory distress, lorocerasis would always work. Especially in case of status asthmaticus, when patient loses breath and there is no remedy that you're thinking of, and he's just, just gasping for breath, give lorocerasis. It will act. Definitely act. It will give you time to think of some other remedy at least till that time. Another very important remedy is Kali Carb. As you all know, 3am aggravation with relief on standing with the support and bending downwards. It is a fantastic remedy and never fails when it is given when it is indicated, obviously. The 3am aggravation and better by standing with support and bending downwards. If you get the symptom, Kali Carb just never fails, never ever fails. Be it bronchitis, be it pneumonia, be it asthma, be it asthmatic cough, be it respiratory distress. If you are getting this symptom, Kali Carb never fails. And Dr. Hahnemann or Dr. Kent, I'm forgetting who wrote this, that a case of pneumonia, a leftover case of pneumonia, close it off with Kali Carb. I always do that. I just close off the case with one dose of Kali Carb, 30 or 200, depending upon the susceptibility of that patient. So it is such a fantastic remedy. It is a very, very deep acting remedy, but also in acute cases, it gives fantastic results whenever indicated. Another remedy I want to talk about is amyl nitrosum. it presents with constant yawning while being breathless. So again, this yawning comes from the air hunger. Air hunger comes due to that distress, due to the low oxygenation. So whenever you see a patient yawning and along with being breathless, think of a mild notrosum. You can give it in 3x or 6 potency and it acts very nicely. Now, another medicine is antimonium ars. We call it as a homeopathic ventilator. When nothing is working and patient is literally on the deathbed, antim ars does good to him. Does good in a sense that the the respiration is aided, the oxygenation is made better. It is antimony ars is usually used in literally terminal cases when everything else is not giving you any result. Carbovage and antimony ars are literally in the terminal cases, the last stages, where we are trying to make, if I can put it, the suffering less harmful, or suffering less for the patients. So, anti-mass and even carbovage, as you all know, cold body, breath cold, pulse imperceptible, respiration quickened, must be fanned very hard, especially on the face. Carbovage and anti-mass, usually given as homeopathic ventilators at the very last stages of respiratory distress. Now, acute bronchitis. I think we all see a lot of cases of acute bronchitis. Wheezing is very common. That is the feature that differentiates it from the rest of the respiratory conditions. It also presents with fatigue, fever, chest discomfort, wheezing, as I said, shortness of breath, and cough that produces mucus. Now, this mucus, the characteristic of the mucus differentiates with a lot of remedies. We'll discuss that how. I'll discuss a case here. This is a case of a 43-year-old female who was constantly coughing, especially during night, making it impossible for her to sleep. There was tremendous difficulty in breathing, could not even visit the clinic and consulted over a phone call. She was already a chronic case of bronchitis. This was an acute exacerbation. She had been on inhalers and steroids, but nothing was helping her. She had been suffering for over 1 week, and her daughter is my patient, so she thought of consulting me. She gave me a call ki, Doctor Sahab, I am in really bad situation. I cannot come. I have no energy to come. I'm just constantly unable to breathe. I'm constantly coughing. I have not been able to sleep for 1 week. मुझे कुछ, just give me something to sleep. She did not even want something to, take care of her cough or breathing. She just wanted to sleep. I just want to sleep. Wheezing was heard even without auscultation. So what I'm trying to say here is, her as she was not able to speak too much on phone, uh, her husband was attending the call as well. So I asked him ki if you can hear any whistling sound, and he was saying yes, while breathing she's especially while exhaling there are whistling sounds. Persistent cough relieved by tight pressure on the chest. The only modality. Persistent cough relieved by tight pressure on the chest, tightly pressing the chest, tightly constricting the chest. That would only relieve her cough. With a dry mouth, yes. The thirst was quite intense. This is the female. This is what she has to say. Please listen to her first.
एक हफ्ते से सोई नहीं थी, मुझे सांस भी नहीं आ रहा था। सर की मेडिसिन लेने से मेरी 2 दिन पड़ी ली थी, दिन से रिलीफ हो गया, सोई बहुत ज्यादा। एक हफ्ते बाद जाके मुझे मिला, वो भी 2 दिन पड़ी आनी। तो मैं तो सर की थैंकफुल हूँ कि मुझे मेडिसिन छूट करी।
Thank you. So this is just the next day of prescribing. She came back herself. I gave her Briania actually. as you can see, I gave her Bryonia alba. Bryonia alba was given entirely on the presentation that was a dry mouth and cough was better by tight pressure. The tight pressure was the only thing that she gave me, and I gave her Bryonia and just 3 doses of Bryonia, and you can hear what she's saying. She just took 2-3 doses and she slept peacefully. Not just peacefully, the cough was much better. The energy was restored, and she was able to come to the clinic the next day for her follow-up. And on the follow-up, I gave her Blata orientalis 6 due to intense wheezing, the choking feeling, and if you read it in the if you remember the condition, there was an intense cough at night, especially while lying down. So Blata orientalis 6 and Aurelia racemosa mother tincture. So Aurelia racemosa is a fantastic remedy indicated when there is bronchitis, especially at night. Patient is unable to sleep due to cough. Always there would be a feeling of something in the throat as if feeling choked. So Aurelia racemosa mother tincture and Blata 6 were given, and Bryonia. And it is in front of you. She responded beautifully, and in merely 2-3 days, she was completely restored back to her health. And now she's on her regular treatment for other ailments and chronic bronchitis as well. So I've not been able to completely cure her of the chronic bronchitis, but because it has been almost 15-16 years that she's been on inhalers and steroids. We have reduced her, completely stopped the steroids. We have reduced her inhalers to about once a week or maybe once in 10 days. But the more important thing here is that she does not need to, that the belief in homeopathy is completely restored here. Now, she will not go to any allopathic doctor ever now, because she has not had any such acute episode again. This is a video from the beginning of this year, or maybe last year. Yeah, last year. This is a video from last year, and it's been almost 1.5 years, and she hasn't had such an acute episode that she has to go to any steroid or any inhalers or any such things. So this is another beautiful way how homeopathy can help in such cases in acute respiratory conditions. And another one, I think do I have time? Yeah. Another one small clinical tip that I use, especially we get a lot of adenoid cases these days, adenoid hypertrophy conditions these days, along with tonsillitis. So I give Hydrastis myrrh tincture to sniff. So what it does is, usually this adenoid cases, kids, they present with typical adenoid facies, typical inability to sleep properly at night. Nose would be blocked. They would sleep with mouth open. Air breathing would be there and will feel thirsty. These are common symptoms of adenoids. We all know that. But just giving Hydrastis to sniff, or put Hydrastis myrrh tincture in while steaming, it gives that instant vasodilatation relief, and the child is able to sleep properly. And if the child is able to sleep properly, you take care of the stress and the panic and the anxiety of the parents. If the parents are not anxious, you have all the time to make and take the case properly. You have all the time to give your constitutional remedy. They will wait for as much time as you want, but the child should be able to sleep. And Hydrastis mother tincture sniffing, or just give it in steam, makes the child sleep beautifully. You can try it with even sinusitis cases, where or in nasal polyp cases where the patient complains of acute nasal blockage and inability to sleep at night. It gives fantastic results. Once you feel that your medicine is acting nicely, now you can take it off, completely take it off, and the person would sleep nicely. You won't need to give it all the time. So this was all. Thank you so much. I hope my presentation was of any use, and
Thank you,
we
Doctor. Thank you
we
so
learned
much.
something.
It was very useful. And the respiratory cases, every time we will have a confusion while treating the respiratory cases. If they are again and again, if they are complaining about something, we'll be in we'll be in confusion that whether our medicine is acting or not like this. Anyway, wonderful session, and you have, as you said, unfortunately, you have shown the cases of case of a boy from August 12th this year. You have shown the same case, no?
It was exactly 1 year ago.
Yeah.
That's what I said.
Yeah, that's
like a
also,
sweet omen.
yeah. Really wonderful cases that you have shown here, and you have given some hint about the other medicines to treat the respiratory cases.
Yes.
We have only few minutes, only 4
Any
minutes.
questions? Anybody wants to have any questions?
Anybody
I'd
wants
like
to
to
talk? Only 4 minutes. In that 4 minutes, if you have any question to ask, you can ask. Please.
Doctor, I think you can conclude the next doctor's closing note.
Yes. Yes, Dr. Sanket Gupta. It's really a very good session.
Good evening, sir. Thank you, sir.
The respiratory system, respiratory diseases are common nowadays.
Yes.
Particularly the Delhi is the most worst place for respiratory complaints.
Yeah.
And,
Sir, I always tell my patients, I get a lot of patients from the defense background because my area is such where I practice. So I always tell them, because they always, the child always complains with a sore throat whenever they travel from somewhere to Delhi. I always say that this is how Delhi welcomes you. It gives you a respiratory condition.
But what will be your first medicine for them?
So usually, whenever such something, it's like they've just come into Delhi and they've experienced something, then I start with arsenic album, or a natrum sulf, or could be even pothos. Pothos, because dust allergies, dust is quite a lot here in Delhi, and typical symptom of patient feeling that dusty feeling in the throat. It gives that if there is no PQRS, yeah.
Yes.
Even then, only then. If there is a PQRS, then we only go with that only.
Okay. Dr. Amresa, you can say a vote of thanks.
Okay, Dr. Ramparvesha, sir, please say a vote of thanks to Dr.
Thank you. Thank you, Dr. Indini, and everyone. Namaskar. Congratulations, Dr. Sanket Gupta.
Thank you, sir.
Very nice. Excellent session and dynamic presentation, clinical experience, acute respiratory disease. So, acute, lot of medicine and seasonal, effect of seasonal acute respiratory disease. And then background respiratory disease suffer suppression of steam, suppression of eruption, and so after respiratory tract available. So very thanks, Dr. Sanket Gupta ji.
Thank you, sir.
On behalf of IFPH पूरे टीम के साथ very thanks again presentation. हर घर होम्योपैथिक, हर घर होम्योपैथिक.
बिल्कुल sir, बिल्कुल. Thank you.
Thank you, Dr. Ramparvesha, sir. Thank you, Dr. Sanket Gupta. And thank you all the participants of the English session. Now we are moving to the Malayalam session. Thank you and good night to everyone. See you the same time tomorrow. And I'm inviting Dr. Manoj for moderating Malayalam session. Dr. Manoj, you're welcome.